Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, the hidden truth in science fiction. Dr. Jack Iwashyna is a Bloomberg Distinguished Professor at Johns Hopkins and an intensive care physician. His son, Sage Iwashyna, is a pastry chef in the Baltimore area. They like to talk about what iconic sci-fi movies get wrong about healthcare, and today they speak with Dr. Josh Sharfstein about some classic scenes and how these errors actually reflect problems in the present day. Let's listen.
Sage and Jack, it is my pleasure to welcome you both to Public Health on Call. We're headed into the world of science fiction and what that world can reveal about ours. You guys have been watching movies together for a while. Sage?
Yeah, since probably my birth would be my guess. It's always been a thing that our family has bonded over is sci-fi and just generally media.
And so, Jack, when did medical questions start creeping up in the family discussion of movies? That's not a typical experience.
So I suspect, Josh, that it's been all along. We did Science Olympiad relatively early as a family, and I taught disease detectives. And so we had some sort of family jokes even going in second and third grade as we were trying to prepare for Science Olympiad and losing to King Elementary every year on year. And so there's a bit of that. I think kind of over the last 4 or 5 years is when Sage actually started saying, wait, explain that to me. And part of that was as Sage started going to conferences with me. I'll bring the kids when I can to a scientific conference, and he'd be there and listen to it and started to understand some of the broader conversations around what we knew and what we didn't know.
Now, we discovered this topic of interest to your family on Twitter because you were posting some pretty strong opinions about medicine in the movies. And we reached out and, it's not typical for a distinguished faculty member like yourself to be tweeting like that. So we figured we wanted to hear the kinds of things that get your family riled up. So why don't you give us an example?
Yeah, I think to start is the one that kind of started the whole thing that started on Twitter is in The Revenge of the Sith.
This is a Star Wars movie.
Yes.
So set the scene. What's happening on screen?
Yeah, so basically we have several characters, and the big thing is that Natalie Portman's character, Padme, is giving birth.
We'll take her to the medical center, quickly.
And the droid, basically the doctor in the scenario, tells family members,
medically, she's completely healthy. For reasons we can't explain, we are losing her.
She's dying.
We don't know why. She has lost the will to live.
Which is, in my opinion, not a great way to talk to family members of patients.
Now, Jack, you are an intensive care unit physician, is that right?
Yeah, so I'm a medical intensive care unit doc. So part of our job is supporting maternal fetal medicine and helping with our incredible OB colleagues to save the lives of young women if they're having a complicated birth.
So you don't typically say this person has lost the will to live, I take it?
No, has lost the will to live is not a part of my lexicon. And it was also, and this was part of what got me interrupting him, right, was obviously not what was going on. This was a young woman who was giving birth on the screen, and they were making no efforts to resuscitate her. And honestly, this scene, I think we were watching it 4 years ago, was just after some of the Serena Williams fiasco, right, where you had a strong Black woman basically being, in a lot of ways, ignored by the medical profession in her postpartum problems. There were a lot of conversations about even pre-pandemic, the early spike in maternal mortality that we were seeing, and this sort of physician droid emotionlessly not engaging with trying to save this woman. Turns out that resonated with me with some of the frustrations I was seeing in medical care and sort of the not going that extra mile for young mothers that just seemed wrong. And I think I was shouting at the droid enough about at least try resuscitating her before you give up. And Sage was like, okay, why has this gotten under your skin this much?
Mm-hmm.
Sage, you're watching your dad yell at the screen. What is that like for you?
Well, I mean, it's always been entertaining. To be honest, I think that you kind of see this parental frustration. And for me, why is this what would have been done in the right scenario if she had a good doctor in a well-resourced ICU? What is the right thing to do here?
It's interesting. And, the reason that we wanted to put this on the podcast was not just for a science fiction discussion, is the connections between what you saw on the screen and what has affected people in the real world. And so this connection between the ignoring of certain women or the mistreatment by the medical profession and what you saw on screen made it a little bit less science fiction.
Absolutely. And so I'm a doc, so I'm not supposed to talk about the fact that there are variations in care and in the quality care. And if you literally have a young white woman, Princess Harvard graduate Natalie Portman can't get good care and can't get listened to, what chance do many people coming into the emergency room have? As you know very much, Josh, the last decade has been another moment of sort of repeated soul searching in medicine about asking why we can't live up to our ideals. And those set of conversations were also something I've had the privilege of having with my kids.
So one solution to that might be the doctors need to be less droid.
Right. So less droid and better, that they need to be both more human and more expert. And that question of how far is far enough is, of course, a central question in the ICU. But the answer was clearly farther than they were going with Padme at the time.
Got it. Okay, let's go to another example. Tell us about this particular movie.
Yeah. So we're next going into the Alien franchise's prequel, which is called Prometheus. It's a look at how the alien race that they encounter throughout the franchise came to be, and that first ship that encountered the aliens. And in the entire Alien franchise, the way that the organisms reproduce is by gestating within a human host and then killing that host upon exit from the abdomen in a quite violent way. And
those of us of a certain generation remember the thing bursting out of chests and bellies in a way that gave us horrors.
I did have nightmares about that, so I do recall.
Yeah, and so one of our heroines in the Prometheus movie is implanted with this, volatile pregnancy, and she then goes to their surgical machine.
Emergency procedures initiated. Please verbally state the nature of your injury.
I need cesarean.
Error. This med pod is calibrated for male patients only and does not offer the procedure you have requested. Please seek medical assistance elsewhere.
Surgery. Abdominal. Penetrating injuries. Foreign body. Initiate.
Surgical procedure to begin.
So the machine is not calibrated for women. How did that strike you, Jack?
As way too real, right? And there are a lot of stories going back about the classic way heart attack signs, for example, are basically designed for people who look like you and I, Josh, that have eaten the diets that you and I might stereotypically have eaten. And we get crushing left shoulder pain. And you're right, it's sort of a very particular sign that we use our hands when we're describing it, and that women present differently. So much of my medical training, it turns out, has consisted of learning this is what it looks like in people who look like my professors, which is what looks like me, and then in some other add-ons.
I recall we had Senator Barbara Mikulski teaching in one of my classes at the School of Public Health. She was an absolute heroine on the issue of more research on women in clinical trials. And she described a scenario where they had a hearing with leaders from NIH, and they were asking them why there were so few women in clinical trials. And one of them actually answered, well, they're not women's bathrooms in the area where we do the studies.
Exactly, right? The ways which it's built into the foundation, right? You don't need to make it explicit. Although, as we know in clinical trials, often we exclude women of pregnant or who could be pregnant or of childbearing age. And you're like, well, that's a really pretty broad group of people to exclude.
Interesting. So how did that issue strike you, Sage?
Yeah, I mean, it's a public health issue. It's a issue within society. It's an issue with the fact that, like, I, as a transgender person, do not fall into that category. As trans people have to fight for our medical care in every aspect of our lives. And yeah, it's coming back to that, listening to your patient and learning, like, what do patients need? That kind of idea of patient first care, like, how do we, fix this?
And having the evidence to support patient first care, which you really need, and not having machines or studies or protocols that just ignore people. Let's go to the third example. And this, I believe, has to do with the end of life care.
Yes. So returning to Star Wars, we are going to look at Darth Vader, Anakin Skywalker. So both looking at his kind of descent from Anakin, who was a human person, to Darth Vader, who was more than half machine parts. And the way that transition is through, like, extremely traumatic burns and without pain management. And he gets some sort of respirator built in his suit. And then if you look at the end of Return of the Jedi, being the third of the original movies that most folks have seen, you have the iconic breath sounds of Darth Vader. And then at the end, you have him taking off this respirator and having a very painful death.
Luke, help me take this mask off.
But you'll die.
Nothing can stop that now.
Go, my son. Leave me.
What would that look like if we could actually manage that breathing issue and that pain to give him a dignified, comfortable death?
I mean, it seems like we're not talking about a technologically unadvanced society, right? They have built quite a lot of starships, for example. So, Jack, you're watching that as an intensive care unit physician, and he's just struggling to breathe and dies there. What are you thinking?
And so this is something my colleague Charlotte Summers out of Cambridge pointed out to me that I'd missed the first time, right? I was all about Obi-Wan at the time I was watching it. That it represented this world that was technologically advanced, but still couldn't actually imagine what good end-of-life care was like. And so imagine that even this prince of the empire had to choose between being able to breathe unassisted and be able to see his son with his own eyes and having invasive mechanical ventilation. And there was no imaginings even of what these even magical beings, the Jedi, could do to provide adequate palliation and provide a good death for folks.
Let alone oxygen.
Right. Like, which is very much what you imagine kind of the state of the art of medical care for death was in the mid 80s when George Lucas was doing it. But I still think in important ways, we haven't been able to have a conversation about what good deaths are like and how we take away machines when they're not helping anymore.
Well, let's have that sort of serious pivot on this case too. So what do you mean that people didn't really understand that palliative care was possible?
Yeah. So when I first started training in the ICU in the 90s, death was the absolute enemy. And everybody was supposed to die getting CPR because that was how we knew we were doing everything. And to do anything else was seen as an abandonment of our first obligations to the patient. And then at some point, a group of really heroic folks, in a lot of ways, starting with the AIDS hospices in St. Christopher's, came out and said, Death is a part of the human condition. Unnecessary deaths should be fought tooth and nail by all means. But there are some times where there's just the body's not working anymore. And can we imagine what it would be like to not prioritize medical interventions at that point, but to instead prioritize people being with their family, Anakin being able to be with Luke and Leia, unmediated by technology? And could we do that in a way that's not just about taking away devices, but that's actually about giving things, doing good medical care to support them being pain-free in those moments? And the reality is often we can. It just takes some work to make sure that's the right place for the patient when it is, because it won't always be, and to have that stuff in place.
So it sounds like we need a new science fiction that really imagines solving some of these problems.
Absolutely. I mean, I think a number of science fiction writers have talked for years about the limits of a purely apocalyptic science fiction, that a science fiction can also provide hope and inspiration, that it's another way of telling the stories about who we could be as a better people, in the same way that it'd be great to have a science fiction that imagined functioning democracies as opposed to needing sort of kings. Sage is nudging me here to wrap this tangent up.
I guess that nudge is a clue for a question for Sage. Would you watch such a movie, Sage? Would you watch a movie that is about, a society, a medical system that works rather than one that is creating all this dramatic tension through problems?
I personally would. I think it comes to that question of, like, for the writers out there, how do we use medicine not as a tool that's failing, but as a tool that's succeeding? How do we use good medical care as a tool in stories so that the story isn't just, oh, we can't save her, so then she has to die, and then killing off the characters. But, oh, we can save her, and what does that mean for the broader story? And to me, that's a much more interesting thing than just giving up on your patient.
Well, I'm with you. I'm with you both. And from your lips to the Writers Guild's notes. So thank you both for joining me to have this fascinating conversation.
Thank you so much, Josh.
Absolutely our pleasure. Thanks, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.